Basically, it was not only about the patients, but also about the carers, which made it very exciting. In actual fact, you felt that, right, we as carers are also being acknowledged in the process. And what are the difficulties we have? Because we always discuss that if we are not comfortable with what we do, we probably won't deliver the best possible. And that was what was one of the fantastic and the new ideas, is that although it is patient-centered care, but also the carer-centered care. So that it was a very good and innovative idea.
I thought that was a really interesting event, actually. I think it's not often the whole team gets together, sits down and talks about the service. I think we have lots of individual meetings. There's often meetings that are quite pressured on time, or there are certain priorities that need to be discussed. And this was an opportunity for us to really sit back and listen to what each individual had to say. The programme team had brought together some of the priorities and some of the key themes from the overarching interviews, and it was really interesting to see that there was commonality there and that there were some real key issues that we could actually as a team start to think, what can we do about that? And are these the really important issues? And I think there was good consensus in the room that yes, they were.
I think doing this project away from the ward and doing it outside of that setting helps people reflect a lot easier around the experience. It also means for staff, they don't feel that they're attached to the ward on that day, and that they can actually really let go and think about how some improvement or how they wanted to change things perhaps for themselves. And I think that's probably quite an important part of the project, because it gets you away from the shop floor, so to speak, but it then lets you in a very nice open environment have a discussion about how you want to plan things.
So a lot of work went into trying to make it as relaxed, and so we had tea, coffee, biscuits, just to make it safe.
It's about staff, patients working together, but it's also about staff from different departments who wouldn't normally meet and in an open forum and discuss changes. And this process brought everybody together, and that's what made these changes straightforward and simple to achieve.